Our speaker today is Dr. Vic Narkar. Dr. Narkar is on the line with us. Welcome, Dr. Narkar.
Thank you.
The title of this evening's webinar is Thermage Total Tip, Lift Your Practice. Dr. Narkar is a board-certified and Mohs Fellowship-trained dermatologist. He is the founder of the Bay Area Laser Institute in San Francisco and the founder of the Cosmetic Bootcamp. Dr. Narkar is the chair of dermatology at California Pacific Medical Center in San Francisco, and he is an associate clinical professor at the University of California at Davis Medical School. Dr. Narkar serves on the board of the ASDS and is the original investigator for numerous lasers, dermal fillers, and botulism toxins. Dr. Narkar also lectures nationally and internationally and is the author of over 100 publications and book chapters. I would now like to turn the presentation over to Dr. Narkar. Dr. Narkar, please go ahead.
Thank you very much, and it is my pleasure to talk to you about my experience with the Total Tip Thermage CPT. And what I'm going to review is how I have really become a huge fan of this treatment as my go-to treatment for skin tightening, as it has become extremely predictable, most importantly with extreme comfort and with long-lasting results. And this has taken over 10 years of FDA clearance and refinements to what I think becomes a very, very popular treatment in our practice. So let's start with our just Thermage at a glance. And it is the first of its kind system, which was the monopolar capacity coupled radiofrequency system. And it is a way to non-invasively help smooth, contour, and remodel skin. And the main unique aspect of this is that with these refinements, we still advocate a single treatment with very little or no downtime. Its indications for use are the non-invasive treatment of wrinkles and oroidids, including the upper and lower eyelids. In fact, it's the only technology that allows you to do that. It also has the clearance for the temporary improvement in the appearance of cellulite. The only contraindication is with patients that have pacemakers, defibrillators, or other electronic implantable devices. So how we've come to this third generation system, which is the CPT, is, if you recall, in 2002, we had the TC3 system, then it evolved into the NXT system, which had the integrated cryogen cooling and also a speed in the treatments and the body hand piece. But the CPT really is now the gold standard because of the comfort level. This is the Comfort Pulse technology. It uses vibration. And it's similar if you've ever gone to the dentist where they grab you before the needle is injected, because the first proprioception that people perceive is vibration. So this allows you to deliver the pulses much more comfortably. The other big advance has been the pulse cooling, which is digital pulse cooling, and the flame treatment tips. And what I'll also be discussing in this webinar is my personal experience and how much comfortable this procedure is. And we have a lot of patients who are coming back to Thermage who've tried other technologies because they were more painful, kind of like the flavor of the month, and then not as predictable and not as long-lasting. And our Thermage business really has increased because of this Comfort Pulse technology. So how Thermage works is it uses bulk heating, but it does it in a controlled fashion. So you've got what's called volumetric bulk heating. So it heats the target very specifically to clinically significant temperatures with a very safe profile. But more importantly, it's what we call uniform and deep distribution of the heat, and it has built-in cooling, and the radiofrequency is pulse, so it allows for a very efficient delivery of the heat, and it minimizes the energy loss for the effective heat transfer. This is where bulk heating, when it's done in a controlled fashion, allows for ultimate collagen remodeling. So this is just a schematic of how radiofrequency heats dermal tissue. You are going into the subcutaneous tissue close to the muscle, and it changes the polarity nearly 7 million times per second. This is unipolar RF. It also achieves what's called an inverse thermal gradient, and these are all in the patents of Thermage. So you've got the application of the cryogen spray, which allows for the cooling of the epidermis. So this is truly a colorblind system. You can use it in every skin type. The heat is then generated by the change in the electric field, and then there's simultaneous cooling of both the epidermis and controlled heating of the dermis. What you also see, and this is why Thermage has really become kind of my favorite, is this sort of sustained volumetric heating. And what you're doing is with these multiple passes, you've got this continuous even heating, so you get better collagen remodeling. And this is sort of the schematic of what happens after a pass, 30 seconds after, 15 seconds after a pass, and 30 seconds, and then so on. The Thermage Total Tip, which is a 3.0, it harnesses the CPT's superior volumetric heating, and it delivers twice as much bulk heating. So what you're getting is better treatment outcomes as a result of this. And my personal favorite for the face now is to use the 1200 count and really deliver a lot of pulses in the submental area to get that tightening and lifting effect that I have not been able to see with anything else. So both the Thermage Total Tip and the 3.0 Face Tip have what's called a thin Kapton or polyamide film frame that provides efficient heat distribution and uniformity. And if you've ever used the older systems of any other system, this is what really causes that more even distribution of the energy, as well as giving you more bulk heating volume. So it's kind of the best of both worlds. You get better better results, but with a lot more comfort. So this frame tip really has changed the way patients even perceive of Thermage, even compared to the NXT, which was eons better than the TC3. So what is the mechanism of the action? And this goes back to 10 years ago. Initial response is you get that immediate collagen contraction. So you see water molecules separated from the collagen molecules, allowing the collagen to denature. This dermal contraction ultimately leads to tightening. The depth penetration is via febrate septae, resulting in contraction and contouring. And then there's this secondary wound healing response. So what I always tell patients is you definitely now, especially with the total tip, you'll see something when you get off the table. You'll see this immediate result, but the continual result goes on for up to 1 year. And what I've been finding with Thermage compared to a lot of other technologies is the sustainability. And most of my patients have actually will say, you know, it's like a 3 to 5 year deal, but we have a lot of patients who come in once a year for maintenance of this tightening. So you see this immediate effect, which patients really appreciate, but I really tell them the long-term effect is what you're going to see. It's sort of the, I call it the gift that keeps on giving. Very good electron microscopy showing how Thermage denatures the collagen, and you see about 3 to 4 millimeters in depth. And then increased dermal density. This is facial skin histology. And you see, even at 4 months, this epidermal dermal density, which is increased, which leads to that sort of collagen stimulation, thickening, as well as skin tightening. And this is also histology showing a significant increase in collagen, which is sustained even up to 30 days and continues for up to 1 year. And you see the collagen, type 3 collagen, which is the collagen of granulation tissue, again, increasing over time. So what is the Thermage Total Tip? The Total Tip is a better way to get better results with your CPT. So number one, you see a visible natural improvement immediately. One of the criticisms that we used to get with the older Thermage is that you wouldn't see an off-the-table results, and a lot of times people want to see something when they walk out of your office. And I often do the halfway point where I'll do the right side of the face or the left side of the face and show them a mirror, and they appreciate the results right away. But I stress to them that this is only something that's going to get better and better. What you see when you leave the office is just the beginning of a sustained result. The second thing is, because of these immediate visible improvements, patients are much happier than they were, and these treatments are very comfortable and easily tolerated. In fact, what I've been seeing in my practice now, with some of the other technologies that were kind of getting a lot of hype, the sustainability of those is not as great as Thermage. So people have tried something else and are coming back to the tried and true Thermage. Versatility, tip selection helps tailor treatments to your patient's needs and desired clinical outcomes. And expanded patient population, the primary areas where I do treat are still the face and neck, but body is becoming more and more of an in-demand procedure, especially with some of the non-invasive fat reduction that we perform. And stock one type of tip for all face and body treatments. The only exception is the eyelids. So there's a specific eye tip, and again, it's the only technology that you can actually use for tightening of the upper and lower eyelids non-invasively. So to review the Thermage CPT system, what CPT stands for is Comfort Pulse Technology. So the software achieves greater comfort. The vibratory handpiece is the golden egg. So what the patients first see before the energy is actually delivered is the sensation of vibration. So the pain has significantly decreased. In fact, to the point where we now rarely medicate. The only patients we ever give anything to is a little bit of Valium for the nervous patients, but the majority of our patients do not have any pre or post medication. And this again makes it a very desirable treatment because patients, when they want something that's non-invasive, not only do they want something that's non-invasive, but they don't want to be snowed during the treatment. The frame treatment tips have also increased the predictability because you get more uniform heating and also more comfort. This system also allows for more bulk heating. So more bulk heating means better collagen contraction, better denaturing of the collagen, and better collagen remodeling. And as a result, you get not only increased patient comfort, but also improved efficacy. And that's why I think people are coming back to Thermage. It's not only the comfort, but with the comfort, there's better efficacy, including, as I said, when you see the results when they leave the office. So how does the comfort software work? The treatment tip is placed against the skin, and then you can set the vibration to levels 1, 2, and 3. Typically on the face, I use about a level 1. I do increase the vibration on more sensitive areas, especially the submental and the neck, to about 2. And then the next thing the patient feels is the heat. And again, just like with the continual protocol, we treat to the point where they feel some degree of heat, but not pain. So multiple paths, low fluence algorithm, and we'll talk about the actual technique in the next few slides. The difference now that I do with my total tip is, as opposed to overlapping, I would do square, 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 and then go back and do circle, 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 and then go back and do square, 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 whereas the old protocol was to do some overlap. And that is the main difference in the total tip technique. Then there's delivery of the cryogen delivered to the cool epidermis. The vibration stops, and then you repeat. So again, 3 bursts of cryogen delivered to the epidermis while the heat continues to be delivered. The heat is delivered deep, and the vibration continues. So this is the vibration handpiece. The handpiece vibrates its tip to mitigate discomfort, reduces pain during treatment by applying vibration to the treatment area, and this inhibits pain impulses. And why is this so important? Because in order to get great results, you have to deliver the entire pulse during the treatment. And what I've been finding when people have had other experiences with other technologies, that they would say that they couldn't tolerate it. They were moving, and either that, they had to get completely snowed during the treatment for them to have consistent results. So with this, it's very rare that, with the exception of a few hot spots, that people will not complete the full pulse of the treatment. And that's been, I think, one of the major advances along with the frame tip. So what are the areas that we can treat? Number one, as I said, you can treat every skin type. It is a true colorblind technology, and you can treat virtually any area where there's laxity. So the eye tip is the one tip where we don't use the vibration. This is for smoothing and contouring. The face and submentum is where we use smoothing, contouring, and remodeling. And then total area, the face, submentum, and body for contouring, strengthening, and remodeling. And, you know, cellulite is something of all the areas, I would say it's the least predictable, so I don't advocate it for that. My main indication, of course, is facial and non-facial skin tightening. So this is what I'm talking about, the total tip protocol. So in the olden days, you would do square, circle, square, circle. So now what we're doing is we're not overlapping. We'll do the squares first, and then you'll go back, and then you'll do the circles. So typically, I'll do about 3 complete passes of each, and then start doing my vectors. So that is the main difference in how we treat with the total tip compared to the old protocol. So we're doing 1 combined pass of circles and squares with alternating rows, and this is the recommended technique for total tip. Now, having said that, before I started doing this, I was doing the old protocol. I did not have any problems, but you might run into a little bit of too much bulk heating if you do that. So the recommended protocol is to do the alternating pass of circles and squares. This also makes it a lot more comfortable. So how do I use the total tip in my practice? I would say the main indication that I've been loving it for is this submental area. This, you know, when people come in, they hate kind of this jowling. Even though we've done filler, we've done Fraxel, we've done lots of other things, this is a big, difficult target area. And so we deliver the pulses with the super pass, which is a combined pass of circles and squares, alternating rows. And what I do is, for example, when I'm using the 1200 tip, I'll do about 300 or 400 pulses right in the submental area and use the rest of the pulses on the face and the neck. So this is why I think I've been getting really, really good results. We're really concentrating more pulses. That extra 300 pulses really makes a difference. You can, on a smaller face, use the 900 tip and also, but concentrate more of your pulses where the action is, which is the lower face and the submentum. So capitalize on delivering more pulses in this area to optimize tightening. When you're using it around the eyes, I do not use the total tip for the actual lids, but you can use the total tip in the periorbital region around the brow bone. So I do like the total tip on the superior aspect of the brow and also the inferior aspect, as well as lateral to the periorbital rhytix. And for the body, I do use it. I would say my #1 area for the body is the abdomen. #2 are the arms, and then the legs, and exactly in terms of the demand and also the efficacy. So particularly post baby belly for skin tightening, and also after some of the non-invasive fat reduction for skin tightening. Patient feedback. So what we want from the patient, this is very, very important, is it just should feel warm and hot, but it should not feel intolerable or very hot. So you want to have, and this does not actually reflect the actual settings on the Thermage, it's just a pain scale from 0 to 4. So we ask patients, do you feel nothing? If they feel nothing, you're too low. If they feel warm, it's comfortable, you're still a little bit too low. It just should be in this sort of warm to hot region. Very hot, I can take it, but not for long. It's not worth doing. And intolerable, obviously, you don't ever want to get there. So my average settings for the majority of my patients for the face are between 3 to 4, and for the neck are between 1.5 to 2.5, and the submental is somewhere in between. Again, this will vary from patient to patient, and I always tell patients, it doesn't, just because it's not hurting doesn't mean it's not working. You don't want to grin and bear it. You want to be comfortable. And that's the whole premise behind this technology, to do multiple passes, low fluence algorithm. So let's look at some before and after pictures, and we'll go through them systematically. So here we are. So this is actually one of my patients that I personally treated, and you can really see off the table pretty dramatic results. And so this is not inconsistent what we're seeing, and this is using the 1200 tip all the way from the forehead to the neck. I concentrated about 300 pulses right in this lower aspect of her face, the submental and the superior aspect of the neck. And I typically do about a third of the pulses on the mid-face, a third here, and then the brow, I leave the last. I find that with the brow, I have many alternatives. In fact, Botox works fabulously for the brow. So it's a perfect complement to your botulinum toxin. In fact, the majority of my patients, when I do Thermage, I will do botulinum toxin on the same day. So they get sort of that fabulous result from the Botox. They get that immediate tightening from the Thermage and then the sustained tightening from the Thermage. Let's look at some more pictures, and here's sort of this sustained result. You can really see nice results, and we're actually now following her. We should have more pictures for you at 6 months and 1 year, and she's been very, very kind and not doing anything else but Thermage. So we'll have long-term pictures, and it continues to get better and better and better. Another before and after picture, we'll go to the next one. This is very popular in our Asian patients who want, again, more of this refined jawline, and really, really popular in Asia. When I went in Asia, they were far ahead of us in using this total tip for the submental, and you can really see this definition and this improvement of the submentum, very natural, but quite dramatic results, again, off the table, which is sustained for up to a year or even longer. We'll look at the next picture. And I'm showing all different types of skin types, again, to emphasize that this is truly a colorblind technology. Again, what you can see is this kind of tightening is really what the patients want. They want this more definition of the jawline, a decrease in the submental, and then you can address some of the other issues with her through toxins and fillers. But this is what where the money is, the submental and neck tightening for the total tip. An example of what you can do with the brow, the eyelids were not treated. This was just treatment of the superior aspect of the brow and the periorbital, and you can see a nice lift there as well. Another example of this kind of sustained improvement, and you can see a nice improvement immediately post-treatment and then sustainable improvement for 2 months, and this remodeling continues for up to a year. Another example, and this is very, very nice. Very difficult to achieve this with anything else other than sort of a surgical procedure. And then you can go back and then you can do a little filler in the prejowl sulcus or in the marionettes. But this is difficult to treat, and this is a very nice result with the total tip. Full face treatment, again, you can see a very nice lift both in the brow, improvement. What patients love about this also, which I've always liked about Thermage, is you never get the overfilled look. And then you can go back and treat the micro areas of fat loss with your dermal filler, and you don't have to overfill them. So I also use my Thermage Total Tip in conjunction with botulinum toxin and fillers all the time. It is completely safe to perform Thermage over fillers, and it's completely safe to perform your botulinum toxin and your filler on the same day as you do Thermage. It's a fabulous combination therapy, but this is just Thermage alone, and you can see improvement in the jowls, improvement in the nasolabial folds, and also a lifting of the brow. And again, showing this nice contouring in the submental area and the jowls, which is sustained for several months after treatment. So what the patients are saying, these are some testimonials. I wanted a pick-me-up treatment for my saggy cheeks and jawline. I must say that the Thermage treatment that I had exceeded my expectations. I saw improvement in my jawline immediately. And here is the clincher. Overall, the experience is very pleasant, and the treatment itself is mild, and I can see myself doing Thermage again. And this is what we're hearing over and over again. I've almost had like a renaissance of Thermage because of some of the other more painful things that are out there, and because patients are looking for results, but they want to have results without discomfort. Here's a nice one. We're also using this a lot more now in men because men want procedures that have a lot of downtime, and men particularly are much more babies than my female patients. So the results were visible just after 1 month, especially along my jaw and chin. Now at 3 months post-treatment, my friends and family have been asking if I've lost weight. This Thermage treatment was very comfortable compared to my previous treatment. I'm extremely satisfied because there's no downtime or telltale signs that something has been done. Again, a very natural look with the total tip. Periorbital and eye treatment, also a very nice result. You can see a lifting of the lids. This is actually with the eyelid tip. So here you're actually treating the lids and the infraorbital area as well as the brow. So when I do the eyes, I do this whole area to get a complete result. Another example, you can really see this laxity improved, and it continues to improve. So I would say before, the eyes used to be our number one predictable reasons. Now I would say both the face, submentum, and the eyes give very dramatic results. What else can you do with the total tip? Well, the original indication of the tip actually was for the body, and these are fairly dramatic results, but you will see tightening in everyone, but I would say not as dramatically as you do on the face and the neck. But body is another rapidly increasing area for demand, especially as we start to do more and more non-invasive fat reduction in the practice. The knees are a great area for Thermage, and usually what I do for this is a lot of times I'll have a 100 or 150 pulses left over at the 1200 tip, and I usually use them on the knees or the elbows or something like that. So you don't necessarily have to use an entire dedicated tip for this indication, and it also gives the patient more value for their treatment. So to summarize, I think this is very, very important. It's interesting that last year was the 10-year anniversary of two of the most popular treatment of the most popular treatments that we do. Of course, Botox celebrated 10 years, and as did Thermage. So this is how I promote it: 10 years of innovation. It means that it's not old technology, but it's technology that keeps getting better and better and refined. Over 2,500 physicians, more than 80 countries worldwide. Patents, we talked about all some of the very unique aspects of RF technology. Over 2.5 million treatments. When I actually had to do a lecture on skin tightening, and I wrote a couple chapters, I saw that compared to anything else, there are more than 50 peer-reviewed articles specifically on Thermage. This is unlike any other tightening technology out there. I love this because you can treat all skin types. It is truly colorblind. Longest history of safe and effective treatments. Again, original aesthetic clearance in 2002. And what I love about this is that it is still a single treatment with long-lasting results, with very little downtime, and patients do ask it for it by name. Now, it's interesting that even though Thermage got a bad rap early on, it's making a comeback. And it's making a comeback because of this innovation, proven results, and I would say the most important thing is really lack of pain. When patients are having a comfortable, pain-free treatment, they'll talk about it. They'll tell their friends, and that's what really builds your practice. So with that, what I wanted to do is to make this very, very interactive, and I want to talk to the audience about my experience, some of the things we can do in increasing patient awareness, what else is out there, and I'd open it up for a discussion at this point. So I thank you very much for sharing my experience with the Thermage Total Tip with you.
Thank you, Dr. Narkar. That was wonderful, and we really appreciate you sharing your experience on the Thermage Total Tip. So we actually have several questions that have come in. And just to remind everyone, if you have a question, please submit it online by typing it into the chat box, which is located on the right-hand side of your screen. The first question, Dr. Narkar, is, do you tend to use all 1,200 pulses on the face?
So I think this is an excellent question because it happens to me almost on a daily basis when I use the Thermage Total Tip. The answer is almost never, and that's why I like the 1,200 count tips. So I will use the majority of them, and I'll usually have about 100 to 150 or sometimes even 200 left over, and that's when I look and see, well, what else is there? And they might have a small belly, so I'll use them on around the periumbilical area. I said the knees and the elbows are a huge demand as well. So I'll utilize the tip in multiple areas, but again, you really want to deliver a lot of pulses and don't skimp on the submental area, the lower face. In fact, because I do so much botulinum toxin, sometimes I'll only do mid-face, lower face, and neck, and then use the remainder pulses on a smaller area. so you can, I love the 1200 count tip for that. The only exception is in very big fat faces where you do have to occasionally use the on the face of the neck.
Great, thank you, Dr. Narkar. The next question is, can we treat a patient with both the cellulite tip and the total tip in one sitting?
That's a good question. My only concern with that would be I would probably prefer to stage it. The only reason is the time involved in doing all of that, and number two is I would be a little concerned about too much bulk heating. So ideally what I would do is to stage it, so you do the I would definitely do the deeper thing first and then do the superficial tip at another time.
Great, thank you, Dr. Narkar. The next question is, are you medicating your patients?
So if you recall when we talked about the biggest, so we'll talk about a few things about this technology. Number one, the answer is no. I don't remember the last time I medicated anyone with Thermage after starting the CPT. We'll occasionally we'll have nervous patients. They're just nervous. I mean, they're nervous when they come in, you know, even from injectables. The only thing now that I offer my Thermage patients is 2.5 to 5 milligrams of Valium. The majority of my patients have not been medicated at all, and this is radically different than even sometimes in my NXT days. I never used the TC3, so I got in when it was the NXT. And most importantly, it differentiates you from other technologies that cannot be done without medication. And the medication is not trivial, and patients, even when they're medicated with some of these other technologies, still say it hurts a lot and it doesn't deliver. So the big differentiating factor of the CPT, number one, is the comfort, number two is the predictability, and number three is the longevity of the results.
Great, thank you. The next question is, do you see more redness or swelling with the total tip when compared to the old face tip?
This is an excellent question. You know, it's not necessarily with the total tip, but if you've ever used the old non-frame tips versus the frame tips, you are going to see a little bit more redness with the new frame tips. And of course, if you deliver more pulses, you're going to see some more redness and swelling. It's pretty transient. What I've been doing now when I see that is my favorite little trick is to use the SkinCeuticals mask. I don't know if many of you have had experience with that, but you can get it from SkinCeuticals. It's a cooling mask. We use it after our Clear and Brilliant and Fraxel treatments. And now we also use it immediately after Thermage if they get a little pink and red. I also will sometimes use my Gentle Waves. But the answer is yes, you do see a little bit more redness and swelling with the frame tips, regardless if it's total or face tip.
Great, thank you, Dr. Narkar. The next question is, how would you combine a Fraxel dual treatment, 1550 or 1927, on the same day as a Thermage total tip treatment?
This is an excellent question because it's another thing that I do all the time. And I apologize because this talk was only about Thermage, but there's some very practical things that I do. So if they're going to do Thermage and Fraxel on the same day, the only reason I discourage it is it's just they're going to be in your office for a long time. But other than that, there's no other reason to discourage it. So I actually have out-of-town patients that come in that want it. So what you would do is you would do the Thermage first. Then I kind of cool them down with that cooling mask, and then I apply my topical anesthetic for my Fraxel, and then do the Fraxel afterwards. Another very popular treatment that I do in my practice is combining Thermage and Clear and Brilliant. The beauty of that is you don't have to wait for the numbing, because a lot of times we don't even numb for Clear and Brilliant, or we'll numb with Elemax for about 10 minutes. It also gives an added value because they see a decrease in their pore size, their fine lines, and their texture, and very little recovery time. So both Thermage and Fraxel Dual and Thermage and Clear and Brilliant can be done on the same day. If you're going to do the Fraxel, either the 1550 or the Dual or the 1927 or the combo, you have to wait another hour, 45 minutes to an hour to numb and do the Fraxel on the same day.
Great, thank you. The next question is, what is the highest energy you would use with the total chip?
So this is an excellent question, and there is no clear-cut answer to that. The total energy is based on what the patient can tolerate. So on the average, it's interesting, the total tip, actually in most people they say it hurts less than even the FACE 900 tip. So I'm actually able to go about 10% higher on my total tip than I was on my standard FACE tip. So the average, what I'm doing on the face is between 3 to 4, level 3 to 4, and I don't know what that actually translates into the fluence. And on the neck, it's between 1.5 to 3. I have gone as high as 5, but that's the exception. So it's really what the patient can tolerate. And remember, it's multiple passes, low fluence algorithm, so you don't need to crank it up to get better results.
Thank you, Dr. Narkar. The next question is, how do you decide where to start your energy settings?
So this is an excellent question as well, because this happens every day. So on the average, I'll start most patients at 3 to 3.5, see what they feel, and then I adjust it, because remember, there are certain areas, so as you go down from the mid-face to the jawline, you do have to decrease the energy because people do feel it more on the jawline, and then when you go to the neck, you decrease it further. So usually I start the face between 3 to 3.5. I'll start the neck at about 1.5 to 2, and then I increase or decrease it accordingly. The other thing is even during the middle of the treatment, you may want to adjust the setting. So you'll do 2 passes entirely at 3.5, and on the 3rd pass, they'll go, oh, this is too hot, so then I turn it down to 3 or whatever. So this is what's so nice about Thermage, is you get feedback, and because it's so comfortable, they're not jumping off the table.
Thank you. The next question is, have you had any patients that have come to you after having a treatment with another skin tightening technology? And if so, what is their feedback?
So, and I don't want, by no means do I ever want to say anything negative about another technology, but I say the one way to increase your Thermage business is to have painful skin tightening technologies in your geographic area. So while I embrace the idea of focused ultrasound, I think it's very intriguing. What we've been finding now that it's been out, I think in San Francisco particularly, there were a lot of systems that were infiltrated in the area. We've actually grown our Thermage practice because of now the patients are coming back several months or even a year after they've had focused ultrasound saying, well, I went through all that pain and it didn't really work. So the answer is having these other technologies actually can grow your practice because you'll have a higher demand because of the lack of pain, the predictability. And the way I position Thermage is it's taken 10 years to perfect it. Because a lot of times people will go, well, it's not. I heard about this new thing. It's newer and it's better and it can lift and it can tighten. And I say, just look at what our #1 procedure in our practice is. It's 10 years old. It's Botox cosmetic. It delivers. Just because it's old doesn't mean it doesn't work. And what's great about Thermage is that the 10 years it's taken to really refine it to make it the best tightening technology. So the answer is having these more painful technologies has actually grown my Thermage business.
Great. Thank you, Dr. Narkar. The next question is, how often or how frequently do you recommend another Thermage treatment? Is it 6 months or 12 months, and what would be the earliest?
So this is a great question, and unfortunately, the one with this does not have, I like to have more evidence-based answers for this type of a question. Everything else we've been answering has been more experiential. So when a patient comes to me for a consultation, they ask me, how long does it last? And the beauty of Thermage is because we've had it for so long, we can actually kind of give them an answer, whereas with other technologies, you really can't. So I tell them that the average, reasonable person who's willing to sort of be appropriate, it can be 2 to 3 years before they have to repeat it. But we have quite a few patients in the practice. I would say, if I were to quantify it, about 20% of our patients do it once a year for maintenance. So I give a range of 1 to 3 years as a realistic expectation of when you have to come back and do it again. There is, however, it's increasing more and more patients who really view this as maintenance. They do it and they go, I want to keep it up. And they're very comfortable with that because they do botulinum toxin fillers repetitively. And I said this is more of the long-term investment compared to, I'd say botulinum toxin shortest, then fillers, then Thermage, and that sort of order in terms of longevity.
Okay, thank you, Dr. Narkar. So we're going to take one more question, and that is, what age group or type of patients have you seen the most significant results?
So this is an excellent question. I would say not as much as the age group, but really if someone is truly, truly jowly that needs a facelift, they should not be a candidate for Thermage. I do find that, interestingly, men tend to respond better than women overall to Thermage. Maybe it has to do with the thickness of the skin, the sebaceous glands, whatever, but I do notice that men tend to do better. Now, I haven't seen a direct correlation between age and responsiveness. I've done patients as young in their mid to late 20s, and I have even done patients in their 80s who absolutely refused a facelift. Now, interestingly, some of the most dramatic results we've seen are in patients who've had a previous facelift, and it's about 5 to 7 years old, and they don't want to do it again. I would say they get the most dramatic results. So there isn't a direct correlation between age. I do think in gender, men tend to respond better than women.
Great, thank you, Dr. Narkar. We want to thank everyone for attending this evening, and also, once again, thank you, Dr. Narkar, for that wonderful presentation and sharing your very valuable experience. For everyone else, if we were not able to get to your question, please send an email to us at marketing@solta.com, and we will be sure to send your question off to Dr. Narkar for an answer. And we also welcome your comments and your feedback regarding this presentation. We also would like to invite everyone to join our next webinar in late June, which will be on vasor lipo. So thanks again to everyone, and good night.